Good evening, everybody. Thank you for joining us. Monarch Family Chiropractic's spinal workshop on talking about sick care versus healthcare and what that means to us and what that means in our society and what that means in our lives and how we live them and how we perceive them so that we can really dial in on where are the areas that maybe we can improve or areas that we're really doing well in and we want to focus on some others and just getting a good perspective of where we sit in this definition of the two. And so without further ado, I'm Dr. Kristen Zawada, and we here at Monarch are going to get started on filling in these blanks. So something that I may show you first is when we talk about what the definition of health is. So before we kind of get to that, I want us to fill in some blanks. So I want everybody to just shout out where you are. If you're joining us on Zoom, I will pop into the chat and see if I can pull some of the feedback from those of you online from home. But for those of us here, I want us to just throw out words that describe sickness to us and what that looks like to you, what it feels like, what it looks like, what it means, how it may show up in your body, how it may show up in your life. So give me a word or words that describe sickness. Weak. Mm. Mm. Oh, you're going to ask me to spell and I'm a bad speller. Yeah. Like that? Inefficient, I think. It looks right to me. Let's see. Oh, yeah. Okay. Mm. Oops. Which mean two different things to people. Those are good words. How about you, Kathy? You have a word? Do you have something that you would describe sick as? I think about, for some people in that stage, it's fear, fearful, not sure, right? Or lack of hope, right? Not sure if there's an answer.
I was about to say,
yeah.
All sicknesses, you get depression.
Yeah.
Anxiety.
IOUS. Yeah.
Oh, you're all doing
good ones. I think weak, because that pops into my mind, I think, just the body can just feel fatigue, like just cannot function, right? So poor function. Yeah, poor function. And you could DIS, DYS, dysregulated.
Yeah, tired.
exhausted.
I think some people in the past said things like icky, contagious. I think those are just words that sit in our Western world, Western medicine, especially in the last few years of what we've went through since 2020, right? Suddenly that means totally different things to people and concerns that maybe makes them anxious or fearful when someone is sick around them now compared to what that used to feel like or be like, or what we would associate with that. I think that's spelled right. Okay, I think those are a lot of good descriptive words as to what sick means to a lot of people. Now let's talk about health. Let's talk about how we describe what health means to us, or what healthy means, feels like, sounds like.
Motion.
Vitality. Motion. Energetic. I think there might be a T. E-R-E-T. There you go. That's better. Oh, okay. No red line. Okay.
Feels joyful.
Happy, yeah, happy.
Yeah.
Hopeful.
You say strength, because we have like the opposites would apply.
Right. Almost, yeah. Right. The opposites apply. So that could be, yes, more connected. Really good.
Sorks here.
maybe more motivation.
Okay.
Oh, I had a word in went right before you said that that made me think of that you said. Let's see. I mean, like you said, like we talked about on the other side, maybe definitely more functioning.
Regulated,
Yeah,
like makes me think of being regulated in my sleep and.
I was just gonna say that is to me like good sleep, happy digestion.
Ooh, clear, like clarity or
Yes,
sinuses even.
And clear-headed, yeah.
Yeah.
clarity. Yeah, because exactly that, right? In our physical, mental, yeah, emotional, right? All the
Metal.
components. Oh, whoopsie. Oh boy.
It's rock on.
Is that even spelled right? Yeah, you're talking about worst speller right here. And I might making this. I'm doing the typing. I think like vibrant,
Mhm.
youthful is words that have come up before, right? We talk about that in our new patient family health history and history of traumas when we ask questions like how do you feel? Do you feel your age? Do you feel 5-10 years older? If this pain didn't go away, or if this condition, if this health didn't improve, where would we put ourselves on the spectrum of do we feel our age? Where do we feel along the health line continuum? And this leads into talking about something that we don't necessarily have as a graphic in this workshop, but we've used it in a bunch of others, which is that we're on a continuum, right? We are either going, nobody's sitting still in this stagnant place. You're either moving towards health or away from health, or looking at it that you're either moving in a healthy trajectory or down a sick death trajectory, right? I mean, it's just, we're going one direction or the other, when nobody's sitting still and not moving, changing, evolving, progressing in some fashion. So we really want to look at how do we go towards that direction, right? How do we go towards that right side of the spectrum, not the left? And what does that mean to us? Because those of us, I feel like, that get how our body works and are under care and understand how subluxations can create the effects of them can be pain and some of these symptoms, but that a lot of symptoms are not felt until they have been there for years or have affected the system at that 60, 70, 80% of pressure upon the nervous system and brain who send all these signals and regulate all these things for us. And if we don't feel that, many times people correlate, I feel fine, I'm healthy. I feel awful, I'm sick. And that's not really how it works, right? It isn't that black and white or cut and dry. And so we can have a trajectory going down a less healthy or more sick path well before we know it or feel it. And by the time we feel it or have some of those chronic ailments, there has been years of that buildup, right? Years of things going into the non-healthy trajectory. We just didn't feel it yet. When we were doing things a few weeks to a month or so ago, when we had our patient appreciation and we had all the fun things in the office describing and correlating fruit and vegetables and things and how to our health and to our body's function, we used one of the analogies of the weight of a dime. So think about the weight of the dime that could be in your pocket right now, or that could be in your palm that most of us, I think, know we wouldn't feel, right? Or feel much of. Maybe you feel it tactile on your skin, but you wouldn't feel the weight of the dime, right? Well, that's about the amount of pressure it takes on the nerve or the nervous systems when they do tests upon the spinal cord. They are only putting the weight of the pressure of about a dime that changes the trajectory of that nervous system signal, that flow of information through, by up to 60%. And so there is very little pressure needed in order to affect our health and our system functioning. And so again, longevity of that function being low or less than is what then creates the subluxations that happen in our system, our body trying to compensate for things, and then slowly creating these words, right? These feelings, these conditions that lead to a lot of this sickness and chronic sickness in our world today and in our country for sure. When it comes to health, let's talk about what leads to the following things. So let's go down here to my next spot. So when it comes to your health, what leads to sickness?
Poor sleep, or diet.
Oops. So lack of or poor sleep or poor eating. Lack of movement, right? We get stagnant. We get still. And that's the last place our system's supposed to be, is still. And there's a purpose to being still, to being rested, right? We need to be still to sleep, to recharge, to reset, to allow the body to do that healing process and reset and rebuild and rejuvenate for the next day. But when we're awake, we're not supposed to be still. That's not how we're designed. We're designed to be in motion and movement, right? So to me, that brings back the inactivity, right? Is usually what leads to that. We've had more patients come in lately with changes in their routine. And when they've been the most subluxated, the most stiff, the most achy, and just different on the table, they haven't been doing more and like doing something new. They have been sitting still for like the whole weekend, and then we see them on Monday and it's like, who is this body? What is this frame doing? And it's that they have had so much less movement. Or we had that a while back when we had that really intense set of weather where we just had storms every day and everybody was just kind of hunkered down for a while and wasn't doing the typical activities I feel like we do in Colorado and getting out. And everybody was just stiff and achy. And it was because we were sitting and hunkering down on our couches and maybe binging on some Netflix or just doing more sedentary activities. And it showed up in our bodies within a handful of days, or definitely a couple of weeks when we had that few week period of lots of storms on the weekends and, keeping people from being outside. Very similar words, I feel like, to up above that we didn't necessarily touch on last time we did this, but, sickness leads to depression. I mean, it just leads to, we can't be in a happy mood regulating happy hormones when we feel unhealthy, right? Thank you, Kayla. Oops. Is it DI? Yep. Yeah, I'll get where I'm going with this. Okay. Yes, diminished immunity, right? Because all of these things take a toll and play that role in making our systems have to work harder than they need to, or than they should, right? And so all of those things that tax it, if we don't rest, if we're not getting good sleep, if we're not putting good fuel in us, or we're eating poor things or making poor choices, or even just not hydrated, our immune system has to work overly hard to do what it's supposed to do.
Also, when we're being reactive instead of
proactive. So subluxations make us sick, right?
stress.
Tell me what you just said again, Jesse.
When we're being reactive.
Oh, yes.
Instead of proactive.
Reactive, right? Because one more that I'm gonna put here that before we tag to the other side is this is leading down a path of infection, of chronic pain. No, that's not how you spell that word. Right? Not so fun path. But exactly what you were just getting at, Jesse, is what is with health. Whoops. Oh, hang on. I don't have a mouse and this is going where I want it to. That in being, what's the opposite of being reactive? Yeah. Right.
To me, it is getting adjusted,
Yep.
right? Reset that body and that nervous system and that brain. Of course, all the things that are the opposite of what we just said, right? It is eating well, it is hydrating and keeping that body full. 70% plus of a body is made of water. Over 90% of the brain is fluid.
So clean environment, like clean air, outdoor activity,
Exactly.
stuff like that.
Clean air, activity. I
Connections.
was just gonna say, how else can we go outside of just the physical, right? Community connections, hugs, love, laughter, right? Truly is. We think about thoughts, traumas, toxins. We got to think about what are we thinking? How does that affect our chemistry and our brain and our health and our vitality and our place of joy and peace and safety? Physically, how are we moving and making choices that make our physical body well by what we put in it, and how we treat it and how we move it, right? Yeah, right. What's between the two ears? Education is more powerful than the adjustment, which is why we are here tonight. One thing that I didn't include on the other, and again, going to that mental place of its body, mind, spirit, right? So we know in the physical, the toxic, it can be the environmental toxins, but it can be the toxic environment we're around as a person. If there's a person or people we're around that are not either in a different mindset than us, in a not positive place, in their own place that projects onto us, that just changes our physiology, right? Is who we're around. So in the sense of things we can do that to uplift that from the brain perspective and chemistry, it's meditate, or some version of meditation or quiet time or breath work, right? Breathing and just being grateful, right? Being present. Those kinds of things, right? That's what creates a healthy nervous system from different perspectives. So when we look at what defines health, this is the definition when you look it up. A state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, right? I think that's very true. I think we just stated that's what we think it is, right? Without knowing it, which is kind of cool. But it is, multiple aspects. So most people find us because they have physically got pain that they can't get rid of. And in the time frame it's taken, many of them, and trying other things first, because sometimes this is their last resort with what we do. Unfortunately, we hope to change that trajectory and it be more of the mainstream thing that people know is so much less invasive and so much less chemical laden of any type to change the physiology and change what you're feeling in the physical world, instead of just masking or numbing out. There's a component of these three factors and that it has to come from all places, but many people find us because the physical pain, the physical aspect of them not being able to do what they want to do or feel the way they want to feel. So it's not that hard to get rid of pain. It is harder to keep it gone because there are things we have to do to continue that journey, right? To stay on that health trajectory. And again, not just quit doing the healthy things when we feel better, right? And what habits are we going to instill so that that becomes we're going in the trajectory towards health, not away from it, and towards disease, sickness, death, really, right? When we look at it, we're going one direction or the other. So we're all aging, but let's do it slowly. Let's do it gracefully. Let's do it with vitality and in the best of our abilities to have it be the highest of quality. So our system with what diagnostics are used to evaluate health or sickness, right? So what do we think of when we are going to assess whether we are sick or healthy? And we may just talk about this reactive state and then a little bit of what we do.
going to the doctor, going to the chiropractor,
Yeah.
I guess.
So there's a place of looking at prevention. For some people, that is blood work. Whoops. Another thing people mentioned was like doing your annual exam and getting checkups, right? Going in and being preventative, being going in and, you know, whether you are feeling different or not, you're going in and having some things evaluated. It may be weight, right? When people look at what their BMI is. So their kind of weight, their body mass index. Things like pulmonary, lungs, heart, right? So that might mean exams, that might mean x-rays, or some version of scans, right? Whether it's CAT scan, MRI, x-ray, ultrasound, right? Lots of ways as far as evaluating or diagnostics to be used. And I think that when we're looking at our health, how are we evaluating it? And we are looking at how we move, right? Ranges of motion. What's our function? Exactly. We do testing. I mean, we want to know baselines, right? We're looking at vitals. I want to know if your blood pressure's through the roof. That's not healthy. But bigger picture things, what is the nervous system doing? What's it saying, right? So when we do our scans, this is looking deep into how is the thermal system, the deepest layer of your nervous system, working. So this is like your organs and glands. That's one thing we test and scan for, right? When we're assessing your health. Surface EMG, right? That's electromuscle This is what are your muscles doing that are holding your postural muscles, the muscles that hold or that your spine, right? What are the two things fully encased in bone in our body? Do any of you know? Yep, your spinal cord and your brain. Exactly. So wouldn't that make the most sense that we are protecting the most vital organs in our body to function, which is our brain and our spinal cord. And our spinal cord is just the extension of the brain. It literally just changes the name when it leaves our head and goes into our neck and goes down the rest of our body. So I think we were brilliantly designed. The two things that are the most vital for our health are fully encased in bone to protect them. And that is why we're checking the spine and that whole part of the head and the connection to the brain is because they're our most vital organs and system that runs us. So that's another assessment that we do. X-rays is definitely another one we do, right? Things that are assessing structure from a sense of not necessarily like you may look there for tumors and breaks and fractures and soft tissue injuries. But bigger picture, if those are clear, is if you're not functioning well in your x-rays, that will show the degeneration, right? If there's degeneration or decay. And well, I can't talk and type the same. Generation, right? Decay. If the spine has not been moving, if our structure has not been moving well, within 5 to 7 years, we will see it on x-ray. We will see the degeneration and the decay beginning, right? So those are those phases of degeneration we talk about in the office from 1 to 4, and places along the way, and from healthy and normal. So we can tell the length of time something's been there if we just look at what the structure has been doing that has been holding our frame up and allowing for functionality or not for our whole lifetime. So age is just a number. This does not mean if I'm 30 and 40, I bet my spine is healthy and looks great. I could show you otherwise. And when you attend our workshops that are more on spinal hygiene and the ones about curves and our structure, we will show you unhealthy spines that look worse of people in their 30s and 40s than some of my 70 and 80-year-olds. It is about how you care for it. So hopefully this gave you some insight as to what are we looking at? What should we assess? What does it tell us? And
this is one thing I want to just kind of end with these two, is that, you know, pain is never the problem. It is the body's warning signal to tell us something is going on, and please address it, and please help me. So these are how, in a way, I define and we define healthcare versus sick care. So how are you handling your warning signals? And do you have them yet? And are you doing any of those preventative things to keep them away, to keep them at bay, right? So the intent in sick care, in our opinion, is really more suppressing or controlling or putting the Band-Aid on the pain. We want to release the pressure that is creating that pain and grow from that, right? And not just Band-Aid or put the sign, cover up the warning sign. The outcome is really about function, like you guys all said, versus how we feel. In the timeline, it is about lifestyle. We have to take care of our bodies and our frame and our structure and all of our things for our lifetime, not just short term when it's in pain or crisis. It's gotten into crisis because we haven't cared for it, most likely, right? Or not in the right way. So it's a lifetime of care that we need to do, not just in certain moments of time. And how do we spend, like, what do we focus on? Is it, to me, more of our belief system and how health is created and what we can do to control it, right? Or how much control we have over our health, versus feeling more like it's just, what's our behavior and how do we behave towards an illness, versus our belief system and how we could overcome. So sometimes that's really where we see a lot of fearful states in a sick care versus a hopeful state in somebody in the health side of things. And really in our mind, Dr. Micah and I, and any other chiropractor, doctor for that matter, but chiropractor is not healing you. We're not the heroes. Your body and your nervous system is. We're just providing mobility and movement in places where those subluxations have burrowed in, if you will, and not had the proper movement for some time. So when we get that brain connection for the body, through the body with providing adjustments and mobility, your body's doing the rest. It's healing that ailment. It's doing the now vitality aspect, right? That's not anything coming from us. So please don't give your providers that ego. That's just not it's not true, right? We aren't healing you. Your body's healing you. Your innate intelligence of your brain to your body to all those organ systems is healing you, right? So give yourselves the credit for doing the work, not a doctor. And really, a lot of times we see it being a money-driven thing. Our Western society focuses on insurance and pharmaceuticals more so, and can I get it covered, and will I get reimbursed, and is it paid for, versus this is my health, whatever I've got to do, I'm going to do. Network or in-network, self-pay or insurance. It's got to be what's the goal and what do we need out of it? What do we need, for our body, for our trajectory of health, instead of it being based around money. Obviously, money plays a part in doing all things. And obviously it is an important role in being able to do the healthy things, but it shouldn't be the decider, or the only decider. And, when we look at fees, I mentioned that just because so much now the way insurance is happening or run, or the deductibles people have to meet in order to get any coverage, is many people pay much less out of pocket, and the healthcare provided out of network can be so much lower because they're not playing the insurance game. And someone's not having to meet deductibles or take a reduced fee that the insurance companies dictate, and they tell you how much you get to make for the adjustment. I can't get started on my opinion about that. That's a whole nother topic. And it just makes the expenses higher for our entire country, when that game is really played or is participated in. So many times people can actually get more affordable care, unfortunately, outside the insurance realm or outside their benefits. So in closing, I want to show you what we call our engagement spectrum. And I'll leave you with this so that you can ask questions and want for more, as we say. And the words that fill in these spaces, which I thought I could get crafty and maybe get into a document where I could type over this, but I'm going to just tell them to you. And this is going to be a topic into a next workshop, one of the next ones coming up, is are we on, what part of the engagement spectrum are we on? And when you're in the office, this is posted lots of different rooms within the office, so you can see the words and you can see how it relates. But when you're in that red zone or that lowest zone of just, in a sense, desperation, it is an unengaged individual. It is someone that is not participating in their health and is disengaged in the process and what their body is probably even saying and doing. As we go up into that orange, it's more non-responsive category, and almost just like sometimes not knowing what to do, right? Or how to do it. And when you get into that yellow category, it's being more self-serving. So looking at things about what's going on with them, but not any bigger picture than that. Nothing about their community, nothing maybe about their family, nothing about others. It's just about where they're at. And then when we can get past that and we start educating and we start learning more and you start attending things like this and picking up tidbits and really seeing where your philosophy is, then it gets into educational, right? It starts engaging the mind and engaging questions about, well, why this? Well, why not that? Well, what's so big about this? Well, and filling our brains with good knowledge that helps us make better choices and better decisions, or maybe researching something because we're just like, we read about it or we were told it by a doctor or by somebody, and we're not sure if we buy it. Like, it's making decisions for ourselves and being advocates for ourselves and educating ourselves in whatever fashion that needs to be making better decisions and choices for yourself, and then taking it to that next level as you get into the green and bluish area, which is more where you're in transformational stage, where you're not only transforming your health and your beliefs, but those around you and your family and your partners and your community. And as we get up into that highest level of engagement, into that purplish area, that is when you're really inspired. And you're not only doing healthy things for you, but you're beyond that and thinking about, how do I change my community? How do I change, or my family? Or how do I change my tribe and neighborhood? How do I, change what's happening in the state of our kids these days? And then the state of bigger things, our world and our system and how we function in it, and how to be a better human race, how to leave a legacy you're proud of, how to engage people and then question them, right? Have enough basis of what you understand and believe and be able to educate and explain to others that you can really help transform something other than yourself. So that's what the engagement spectrum in a quick nutshell is. And hopefully you can just look at that and think about where you are on the spectrum and the trajectory of your health, and kind of look at that as, am I going to the left or am I going up and to the right? Because hopefully we're helping engage you into going from in that yellow to, green and blue and purple. So we look forward to your takeaways. Because I started late, I want to wrap up, and I can quickly pop into in a second to the chat and chat with those of you that are online with us. We appreciate you tuning in. And for those of you that get to watch this, we cannot wait to see your takeaways in the office and to put up on the board, on the education station up at the office, where you are maybe on the engagement spectrum, and or where you are feeling you are and where you want to be, and the one thing you got out of a piece that you could move forward in the healthy things that you can do for you and your family, and the lifestyle you wish to leave and the legacy you want to pass on. So thanks for joining us tonight and sticking with us later in this evening. We can't wait to see you in the office, and we're signing off for now. We will talk to you soon. Thank you.